Now, many of you have been sending in your questions about COVID-19, and we want to help you answer them. For that, we're joined, as we are every Saturday, by CBC News medical contributor Dr. Peter Lynn. Dr. Lynn, always great to have you on the show. Let's start with their take on the new modeling. Talk of the second wave in September that's even bigger than the outbreak that we saw earlier in the year. What do you make of it?
And that's exactly what we saw with the Spanish flu. You know, the first bump was small, the second bump was huge. And the reason is very simple, is because now we have more people with the virus that could be asymptomatic. You've heard about these people, no symptoms, so they're not going to get tested, they're not going to get swabbed, but they're still producing the virus in their nose. So they're like a walking factory of viruses. Now, as long as we keep our social distance, in other words, 6 feet apart, and wear a mask and do all those things, I can't infect you. So let's say I'm one of those people. I cannot infect you, John. And so therefore you're protected. So our cases will go down. So the numbers will go down. Then what happens is that then we'll relax. We'll say we haven't had any cases for 3 months. And so therefore we can relax. And as soon as we relax, or we put people in close situations, like for example, the school, then all of a sudden my virus can now come across to you. So let's say you stop the mask. We start just having casual conversation. Now I can pass the virus to you. And because there are many people like me out there, no symptoms, still producing that virus, we can now have many people being infected simultaneously. So that's why that next spike is going to be much larger, because let's say there's 100 people like me walking around. So now all of a sudden I can infect 2, 3, 4, and then you could see the spike go up in that way. And we've seen that in other countries right now. So Germany, France, UK, Spain, they're all above 1,000 cases per day. And New Zealand, that was at 0 for 100 days, no community spread. Now they're popped up to, I think they had 20 cases because of this perhaps asymptomatic person who doesn't know that they have the virus, but is lurking out there. And that's the source of the virus for that second wave.
All right. We are getting a lot of questions about the return to school. So let's turn to Sophie, who she says, I'm a parent with underlying conditions like asthma and diabetes. Should I send my child back to school or daycare? Dr. Lynn?
Yeah, that's a big concern because they may bring back the virus to the family members, and that's of course a big concern. But at the same time, this thing looks like it's going to drag on. So we do need to get the kids back in. So the best thing to do is to make sure your kids are prepared. The system may not be prepared. I think most parents and teachers are saying the system may not be quite right, but we can make the kids prepared. So that means we practice with them about wearing the mask and the shield if they can't wear the mask. We talk about how to, come back home and then decontaminate. In other words, take off the clothes, take a shower, leave the shoes by the door, because shoes, the floors have a lot of viruses on them. So therefore it can come on the shoes. So don't let them run around the house with their shoes. And the bottom of the backpack will have a lot of viruses and things like that. So don't let them put that onto tables. Just leave those things by the door. And that way you won't get the virus entering into your home. So can you send the child home back to school safely? The answer is yes, if we take all these precautions when they bring them back into the home. And that will keep you protected as well.
Okay, you mentioned the mask and the shield. The next question is from Lee Vera. And the question is, I understand it's harder for younger kids to keep masks on all the time. Should we recommend using a face shield instead of a mask for the younger ones? Certainly it's something I've seen with emergency workers. I've seen a number of people in stores wearing the shield instead of the mask. So what is the difference in the efficacy of those two ways?
Yeah, both of them will be worthwhile. So let me just go back to the mask. First of all, look for masks that don't suck in. So when you're breathing, the material doesn't come right in and stick to your face. That's when people feel uncomfortable. So material that's a little stiffer or they've got the pleats on them, test it out on your child. When they breathe in, if you don't see it going in and out, then they're going to have a much easier time. We do not need a complete seal around. All it's doing is stopping the wind power. Remember, the virus cannot move unless there's wind. And so therefore, by having materials in front of you, you stop how far the virus can get out. So instead of 2 feet out, it might only go a couple of inches in front of your face. And that's how you protect other people. It also protects your child because you can't suck in as much. So therefore, the air can't come across and breathe in. I have to be closer to the virus before I can breathe it in. So that protects your child as well. The face shield is doing the same thing. It's leaking everywhere, right? So there's nothing at the top, nothing at the bottom. But what it does is it stops me from sending out viruses this way directly to you. And also, it's harder for me to breathe the virus in because the virus has to make a U-turn underneath the shield. And it's not very easy to do that for the virus because it actually needs the wind flow. So that's why a shield is actually a decent idea for people to use. So if they cannot handle the mask, then what you do is you use a face shield, and you don't need the ones that seal at the top, because when they seal at the top, that's when it fogs up. So they can have holes and stuff like that at the top because we don't need a sealed compartment. We just need to stop the virus from directly coming into your face and being breathed in. So both are good options that you should be looking at. If they can't wear a mask, then a shield is a very good option for them.
Okay, next question about the family bubble. So how does it work? The question coming in, if a family has multiple children all in different grades, they're going to maybe multiple schools, that bubble gets pretty big pretty fast.
Yeah, unfortunately, you're right. So in other words, some provinces are saying the bubble is like 60 people. So in other words, they can be in contact with 60 people during the day. So you could imagine if you have 3 children in different grades, you're now at a bubble of 180 people that you're potentially exposing to, along with the people that are in their family that they're exposing to. So the bubble gets very large. The good news is that if you think about your child, they don't hang around 60 people all day long. So really it's about 4 or 5 or 6 kids that they're really with most of the day. And so therefore that sort of is a useful piece of information that you're not really exposing yourself to 180 people, probably more like 15, 5 for each kid if you have 3 kids. So know the kids that your children are hanging around with because those are the close contacts that you want to keep in mind. And also tell your child that you should be physically distancing, wearing your mask around those people. So if they keep those rules, remember this virus can't move on its own. This thing cannot move and it can't make photocopies of itself. So it actually needs us to do every single step to help it replicate. So if your child is taking those precautions, then their 5 or 6 people are still taking precautions, then that cuts down the risk. So realistically, even though we say 60, realistically it's probably like 5 or 6 kids that they're very close in contact with that we have to keep an eye on. And in terms of contact tracing, it'll be easier if you know all the kids as well, because you know the group that they're most likely to be exposed from.
Like you say, a lot of parents will have a lot of work to do in the coming weeks. Thank you, Dr. Lin.
Thanks, John.
CBC News medical contributor, Dr. Peter Lin.